took over Social Security. It was Elon Musk at first, and then he, well, it was public what exactly happened there. So he is gone now. But a lot of his people that he hired are still there. The current commissioner of the Social Security Administration said he is a DOGE guy. The acting commissioner of Social Security before the current permanent commissioner, he was definitely a DOGE guy. He was actually under investigation for doing some things that he wasn't supposed to be doing, and he was looking for another job. And then DOGE said, "Hey, you're our guy," and they put him as acting commissioner, and he did all kinds of crazy stuff. So we're going to talk about all that today. This is also going to be a live Q&A. So if you have any questions about all things Social Security, Medicare, retirement benefits, survivor benefits, disability, Medicare, Medicaid, make sure you type them in the chat, and I will get to as many as I possibly can in the next hour. Okay, so let's go down the list and the good, the bad, and the ugly. 6-month report card, exactly how DOGE and Elon Musk has affected Social Security, your Social Security, and all the rest of it. Number one is mass layoffs. Social Security was already hurting. They were at a 50-year low in terms of staffing. And I'm not sure if you heard, but there was a few people born after World War II. 1946 to 1964, 70 million people were born in the United States. Those people are retiring, these giant baby boomers. Social Security needs more help, helping people, by answering the phone, adjudicating their claims, processing their retirement claims, survivor claims, disability claims, all the rest of it. But unfortunately, for many decades, Social Security has been hurting in terms of staffing. So the red line there is staffing. It's been going down. It was even before Elon Musk and DOGE came in, Social Security was at a 50-year low in terms of staffing to help you get your money. And the staffing is, you paid for the staffing. All those decades you paid FICA tax, that was to go for help when you needed it. But unfortunately, Congress refuses to give Social Security that help because they don't want, anyway. But now it's even worse because of Elon Musk and DOGE. They went in there and essentially, for all intents and purposes, vacated those individuals and fired potato. They told a lot of people, it says, hey, you can take this package and walk out the door, or you can throw the dice and not get anything next week or next month. So a lot of people, unfortunately, thousands of people decided to vacate Social Security. And now, if you've been trying to deal with Social Security, you know it has taken an effect, a big effect on your ability to get your benefits. Office closures. I've heard a few people talk about office closures, but I haven't seen anything official yet. I know, when I ran my office, we closed down a card center that was co-located. We just moved all the, all that workload into the district office. Offices move around and stuff, every now and then they lose their lease. A lot of the places that Social Security has their offices, their leased space. So if that landlord, whoever it is, wants another tenant there, then the Social Security office has to move. So that happens sometimes. But no real mass office closures necessarily to speak of. They have closed down the regional centers. There was about 9 regional centers. They've closed down a few of those, and those offices support your local offices. So that's why another reason things are taking so much longer than they should. But one of the things, because of these mass layoffs, there was no rhyme or reason to it. They just decided to cut numbers and they didn't care where it came from. Your office might not be closed, but it might be closed. Because how offices run is there's different units. There are people that just help you with, the front end type stuff, changing your address, simple type stuff. But then if you're actually looking for a retirement claim or survivor claim or SSDI or whatever the case may be, there's a separate unit for that. So the offices are made up of like 1/3 this, 1/3 that, 1/3 that. And the other part is SSI, supplemental security income. So that's how offices are broken up. So in your office, it might be open, but they just might not have anybody that handles your particular need. So the doors are open, but there's nobody there to help, unfortunately. And we see that going across the board, unfortunately. Oh, I've got double screen there. Okay, so what about fraud, waste, and abuse itself? That was the big thing about DOGE. We're going to find, it's the biggest Ponzi scheme, and it's the greatest fraud in U.S. history. Elon Musk made all kinds of allegations, and guess what? Yeah, didn't really find anything, which is amazing because there is fraud in Social Security. People fraudulently file for stuff all the time. People do bad stuff in Social Security. The Office of the Inspector General, Social Security employees find fraud, waste, and abuse every day. Social Security employees out there, if they've been working for Social Security for 3, 4, 5 years, each one of those employees have found more fraud, waste, and abuse than Elon Musk ever did. Guaranteed it, because he made a lot of allegations, and we'll get into some of those allegations, but it turns out much ado about nothing. Okay. One of the things they did immediately is they said, okay, because of fraud, waste, and abuse or whatever, they use that as a kind of a catch-all, abracadabra. As long as a politician says fraud, waste, and abuse, we let them go. We let them do whatever they want to do. That seems to be the new norm. So what they did is DOGE said, hey, we're going to make everybody show their ID. And they really did a terrible job at PR, because if you are a regular viewer to my channel, around that time, everybody was freaking out, stressing out. It says, I live 100 miles from, a Social Security office, and are they going to cancel my Social Security check if I don't go down there and provide my ID? What do? I'm disabled, I'm elderly, I'm 90 years old, just lost my, spouse, and I need to go down there, but I can't. I can only do it online, or I can do it on the phone, but it was a nightmare. And then they were attempting to stop fraud, waste, and abuse. But I can tell you, taking hundreds of thousands of phone appointments, retirement, disability, and stuff, there are a lot of verification processes you have to go through, even over the phone or online. And there's a lot of back-end stuff that catch all the fraud, waste, and abuse. And if they catch it, which they do all the time, they close that case, give you the overpayment, the whole 9 yards. So the whole ID verifications, they walk back. They walked back probably within the first few days, and then they changed it, and then they walked that one back, and it was, what about these millions of people over 120 years old, 200 years old that, was in the news forever and ever and ever? You notice that kind of disappeared from the news. Regular viewers are tired of hearing this, but $0 was paid out of that particular database. Anytime a politician says, we did X, Y, or Z to the Social Security database, they are not telling the truth, because there is no such thing as the Social Security database. No such animal. There are Social Security databases. There's many for different things. Like the ones Elon Musk and DOGE was looking at was the one for Social Security numbers. And it only has that database only has your name, date of birth, where you're born, where your card was issued, your parents' name, your mother's maiden name. That's it. That's zero money comes out of that database. So when they're talking about, we fixed that database, and the president just came in again and said they kicked 275,000 people off of, that's that database again. Zero money comes out of that particular database. Zero money. Okay, since 1935, zero money comes out of that database. And what they did do, though, which is good, is they cleaned up that database. And they said, okay, there's a bunch of people. Yes, there were billions of people in that particular database. Nobody was receiving money. But Social Security has wanted to clean up that database for a while. But in order to do it correctly, they need death certificates. So what it is basically, you have a bunch of people in there, some different categories. You got some people in there that when they were young, they got 2 Social Security numbers, and they've been working under one their entire life. When in the 1960s and 1970s, you apply for Social Security, and then you lose your card, you apply for it again. And I had that situation, and they gave me the same Social Security card. Some people, they get another Social Security number because they changed their name or whatever the case may be, the old IBM Remingtons. And they got 2 Social Security numbers, but they always work under, one, and they never worked on the other one. That one was left open because we don't know, Social Security doesn't have a death certificate for that particular person. So, and then people pass away overseas or missing in action and the war, whatever the case may be. So Social Security had millions of people that It was just hanging out in the database. They couldn't officially, they are not allowed to close those out without an official death certificate. And that would have cost millions of dollars to do. And Social Security said, we will be more than happy. We would love to close out that database. Congress, you have to provide us resources, and we'd be more than happy to do it. And Congress did not want that database to be closed. Why? Because those politicians love to use that as a club to beat up on Social Security. I mean, why take that away? It's like, no, we don't want you to fix it because we love beating you up with it. Every now and then we'll come up with how Social Security is so incompetent. They've got all these deceased people, they're 100, 200 years old. We love it. No, we love it. Don't fix it. Please don't fix it. Because they ultimately wanted to privatize Social Security, and they were using that on purpose. And now Elon Musk and DOGE has done a great thing. Thank you very much. And they're finally cleaning up that database. And there's a lot of politicians out there that are not happy that it's being closed. It's being cleaned up. So beautiful. Great. Good job. Good job. And also the fact that they're working on the Social Security system itself, the entire Social Security system. Another thing that Social Security has been begging Congress for decades. Please, we need resources to update the computer system. It's one of the, the biggest computer systems in the world. It's got everybody's stuff going on back to 1935, all your earnings and all that stuff. And we need to update it. We need to update it. And Congress has continually said, no, 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 no. Why? Same exact reason. They don't want Social Security to exist. There are politicians out there that do not want Social Security to exist. They want it to fail. So they're doing everything in their power to make it look bad and embarrass it and have people lose confidence and trust in the Social Security Administration so they can come by and say, hey, look, these guys are incompetent. Let's go ahead and give all your money to our buddies on Wall Street. So in my description, I've got the plan that they wrote in the 1980s that goes exactly like that. So if you disagree, go to the plan in my YouTube description, and you'll see the plan to that effect that was written in the 1980s. So, but this has been going all the way back since 1935. Another thing, 40%, remember the whole thing about 40% of calls into Social Security are frauds. So all those, if you ever called Social Security, your second call is a fraud. I think that's how the statistics work. They, again, Elon Musk, I think he's pretty good at math, but he's terrible at math, I guess, in this respect. A report came out that said a very, very, very small percentage of people that call into Social Security are attempting to change people's bank deposit, less than 1 or 2%, fraudulent. Of those 1 or 2% that call in trying to fraudulently change somebody's direct deposit or trying to contact Social Security, 40% of those are calls. The other, are people try it online or they go to the local office or whatever the case may be. But 40% of that 1% or so, they try it over the phone. So that's where the 40% of. And then Elon Musk came out and said, well, 40% of everything. Yeah, that's not, yeah. So one of the things that they're doing now is, which a lot of people don't like, is AI. So if you're calling Social Security now, you're going to be talking to an artificial intelligence in order to get through the phone hell. And I've tried it a few times, and it's terrible. It's just not there yet. Maybe one day, but not the now. And they're using those statistics to say, hey, we are doing such a great job. Our phone, people are able to call in and get answers now. No, they're able to call in and get BS from artificial intelligence, and they hang up. And it seems as though the agency is using that as a success because you called in, something happened, and you hung up. So I guess we'll count that as a success. So that's essentially, they're manipulating the numbers a little bit right there. So another thing, Elon Musk and DOGE, and most recently the president said non-citizens are receiving Social Security checks. No. Can non-citizens receive Social Security numbers? Yes. For instance, Melania Trump, Elon Musk, they were non-citizens. They came over. You got people that come over to college. You got people that, come over on work visas that are not U.S. citizens. They pay Social Security. They pay taxes. They need Social Security numbers to do that. And if they come over legally, they have their green card, Social Security. I'm going to do a video on within the next week on exactly how, when you come over, all of the guardrails, all of the places where if you're in this country illegally, you can't get Social Security. I'll go into detail. I'll show you how all that sausage is made, because there's too many people out there thinking people that are in this country illegally receive retirement, disability benefits, and all that. No, that doesn't happen. Obviously, fraud happens, but those people, most of those are eventually caught. It's a very, very, very small number. I'll go into details exactly how that happens. Another thing DOGE did, overpayments. They previous to DOGE and Elon Musk, if you had an overpayment, the default was 10%. They decided to withhold all of your checks, 100%. If for some reason you mess up or Social Security mess up, they withheld all your checks. That lasted a few days. Then they came back and they said, no, no, that's too hard on people, particularly when they can't get in the office to get it fixed. So they went from 10% to 100%, back to 50%, probably within a month. So they changed and changed and changed. You get a pattern here. They don't really know what they're doing in a lot of respects. So in the final analysis, are they protecting Social Security and Medicare? That was one of the things that was given on the campaign promise to protect Social Security. In terms of rating the Social Security Trust Fund and all that, no, that's not happening. One of the problems is that we are going to get cut. You are going to get cut if you're if you're receiving Social Security check, or you're about to receive Social Security. Enjoy it. As of right now, you got 89 checks at that amount, that 100%, and then the 90th check is going to be cut by 23% because the trust fund is being depleted. It wasn't stolen. That's another thing politicians, try to distract us with. It wasn't stolen. The trust fund is there. If you're receiving Social Security, about 10% of your current check comes from the trust fund. It's just that, just with any savings don't last forever. And why is it being cut? Because of 40 years of failure for politicians and us, because we keep being distracted by politicians, and they failed to fix it. The current administration, exactly the same. And you say, well, they've only been in office for 6 months. Before Biden, Trump was president for 4 years. Biden failed to fix it. Obama failed to fix it. Trump failed to fix it. Clinton failed to fix it. Bush failed to fix it. And all the politicians, senators, House representatives for the past 40 years have failed. One of the reasons is because we keep getting distracted on shiny objects. But that's a whole different issue. So without actually, the ability to get your Social Security check and get Medicare started and all that, that's part of the issue, isn't it? Even though there is not a frontal attack on reducing the Social Security Trust Fund or cutting your benefits or raising the retirement age or anything like that, it's kind of like the house burning down. The house is essentially burning down, and right now the administration and current your current political representatives are just watching the Social Security, burn down. And then after 7 years, after 89 checks, then the only alternative is to cut your check by 23%. So if you're good with that, then you're good with that. If not, I would recommend you possibly contact your politicians and see what you can do to make sure they don't cut it. Make sure they finally do something after 40 years of not doing something. So, all right. So if you have any questions on any of that, make sure you put it in the live Q&A, or if you're watching this on a recording, make sure you type it in the chat. But let's go ahead and get to some of your questions. I also have some video questions people ask. Kim asks, I'm turning 65 this year, but I want to continue to work. Should I get my Part A of Medicare until I officially retire at 67? Completely your decision. Some people do that. So you can restrict your application. So, you're coming up on 65, but you don't want to start your monthly check money benefits because you're currently working, making over the $23,400, and you just don't want to start. So no problem. So, but you can start Part A and refuse the money and refuse Part B. No problem. If you have health insurance from current work, yours or your spouse's, and your employer has 20 or more employees, then you do not have to sign up for Part A or B. You don't have to contact Social Security and tell them you don't want it or anything like that. You don't have to do anything. If you're currently receiving money, then you'll be signed up automatically, but you can refuse Part B. But in your particular case, if you want to sign up for Part A, here's why some people do it, even though they have health insurance from work. Number one, Part A is zero premium for probably you, most people. And if your health insurance from work, I would check it out. If you go in a hospital or something like that, and your health insurance from work has a really high deductible, $2 or $3 or $4,000, might be a good idea to get Part A, because the deductible for Part A is $1,676. That could be several times a year if you go into the hospital several times a year, but it might be cheaper. So that's why some people do it. They have that secondary insurance in case they have to go to the hospital, because Part A covers the hospital. But if you were giving to an HSA, a health savings account, then you have to stop contributing to that health savings account 6 months before you signed up for Part A. So, but if you don't want to do any of that, you don't have to do it. You're good. So just when you turn 65, or excuse me, when you stop working and stop receiving health insurance from work, then you go onto my website there, mygovexpert.com, click on that little Medicare thing, and you will be in your special enrollment period. So if you stop working and stop receiving health insurance at 70 years old, then you're in your special enrollment period. There's no penalties whatsoever. You just need a couple of forms. It tells you exactly here how to do it. You just need 2 forms, one to actually sign up, and then one to prevent you from being penalized since you turn 65. But you won't be penalized at all. So you will be in your special enrollment period. No problem whatsoever. So Vicky, I am receiving Social Security. I'm 64, 65, September 8th. Do I need to do anything for Medicare? Yep, exactly the same thing. So I got you. I just answered your question on part of that one. So Joseph, Dr. Ed, everyone on your YouTube channel needs to go to Washington to talk to Congress to save Social Security, Medicare, and Medicaid. Who is with me? Yeah. Or at the very least, contact your senators, House representatives, and because our national politicians have pretty much kicked the can down to the states for Medicaid, which even if you're not receiving Medicaid, you're going to pay for this. I did a video about a week ago on this, that everybody's going to pay for this. You're going to have to pay more out of your pocket and have more nightmares to deal with because of kicking millions of people off of Medicaid. The Medicaid offices throughout the country are going to have a very, very difficult time keeping up with all of the new regulations and everything and all this stuff. So you also need to move your political activities down to the local level in terms of your state, the governor, your 2 representatives, unless you're in Nebraska, which I think is unicameral, and start contacting them and make sure people are taken care of. So how do I get back pay from SSI from brain surgery and 2 strokes? I already have disability now, SSI. So, okay, so you were approved for SSI, Supplemental Security Income. That's the welfare-based program. You're approved based on disability. And you had some back pay coming, but it was a large amount. And when SSI, they don't give you, if you're on SSDI or anything, they give you the one check. That's it. They pay you whatever they owe you back pay, they give it to you, done. But with SSI, because it's a welfare-based program, they don't give you the whole thing. They break it up into usually like 4 different, parts. But if you need that money ahead of the game, you just need to contact Social Security, your local district office, talk to the SSI CS, the Supplemental Security Income claim specialist that's working on your case, hopefully, if they're still there, and say, hey, I know I don't get my next, payment for, a month or 2 months or 3 months or whatever the case may be, but I need that money now because of I have to do this, I have to do that, I have to do this other thing. So if you give them a reason why you need that money ahead of the time, they're usually pretty good about it. So where's the chapter logo on the screen? I only do it when I do live Q&A because, chapter doesn't want to get involved. They support the live Q&A part. So they're awesome like that. So if you need help, with Medicare, Medicare Advantage, Medicare Part D, Medicare supplements, always check out Medicare supplements first. Then please give them a call. They support this channel and all this free information, the website and everything. Okay, I already answered that one. Let's see here. Time travel. Social Security tells people to safeguard their Social Security number, but most Social Security numbers are now on the dark web after all the data breaches. How is it possible? Yeah, you just do your best. Yeah. And the crazy thing is that they used to say that all the time, but then they put your social security number on your Medicare card, which you needed just in case of emergency. So it made no sense whatsoever. But they finally fixed that. And now there's a different, unique beneficiary number on your Medicare card. So yeah, that was always crazy. Thank you, Doctor. I really appreciate your being a tremendous source and support Kearney's SS. You're welcome. Thank you. And Brenda, I really do appreciate you being a tremendous source and support concerning Social Security, because you're going to share, like, subscribe, and share this information and talk to people down the street and people that you know that need help. And you're going to be out there and helping people too. So I appreciate it. You are too awesome, Brenda. Elon should not have anyone's social security number. Oh, and somebody asked, yeah, before we started today, did they get all that information? Yes. They were sued. DOGE was sued and says, hey, you shouldn't have access to everybody's social security information because you don't have, access to it. You're not a regular, social security employee that passed through the whole FBI background check and all that other kind of stuff. And it went to court, and the judge said, no, give them whatever they want. So they have full access to all of our information. And I'm hoping I don't have to come in here, in 6 months or a year and say, hey, Big Balls had all your information on his laptop and he went to, wherever, and it was stolen out of his car. And yeah, so hopefully that doesn't happen. So how much can a married couple make yearly to get help on Medicare Part B? Okay, so you're talking about Medicaid, the Medicare Savings Program. So if you're having a hard time paying for Medicare Part B, the $185, and since you're married, that's $185 times 2, that's a lot of money. You have to go through Medicaid, and each state is different. We're coming up with a new platform. Our community here is coming up with a new platform that's going to help people apply for Medicaid and make sure they're not denied, and make sure they keep it, and make sure they don't have to, help them navigate all the hoops and the bureaucracy. That's coming soon. But you have to file for Medicaid, and it's different on every state. If you're in Alabama, then I think it's what the income threshold for single is about $987. In Texas, it's about $1,000, but at other places like California, it's closer to $1,800. And that's for single. But if you're married, then obviously those thresholds are higher. So I would reach out. Number one, I would reach out to Medicaid in your state and apply and see if you're eligible. And you can say, well, whatever, they deny everybody. Apply. Just apply. If you're close to the threshold or something like that, sometimes they have some type of exclusions. So apply, please apply. And if you're approved, particularly at the higher levels, QMB, Slim B, QI, they're called, then they will pay for your Part B premium, that $185, and your spouse's $185. And then you can get what's called the Medicare Advantage dual eligible plan, and those have the extra grocery cards that you see advertised all the time. They actually do exist, but it really depends on what's available in your area. For that, you can call Chapter, and they can help you out and see if one of those are available in your area. And if those people that have those, if you want to change it, change the plan, you can actually change those plans several times a year. You don't have to wait for October. So if you're looking for a better card, or you need to go to another doctor, or you're having issues with that particular one, you don't like it, reach out to Chapter, and they will see if there's a better one in your area for you. So if you're not approved for Medicaid, the only other alternative is called a Medicare Advantage Part B give back. And what it is the name implies, it gives back part of your Part B. And those are Medicare Advantage plans. And the company pays for part of your Part B. But be careful with those, because, these companies, these billion-dollar companies, they don't get to be billion-dollar companies by being dumb, right? If they are going to give you money, pay for part of your Part B, they're going to take it out of other places. So if you're young and healthy, 65, 66, 67, whatever, and healthy, then, hey, it might be a good idea, get $100 paid back, $185, depending on what's available in your area. And then next year, switch to one, once you start getting a little bit sicker or older, or whatever the case may be. So those are two options: Medicaid or a Medicare Advantage Part B give back. So Lisa, I receive SSDI and widow's benefits. When I turn full retirement age, it rolls over to regular Social Security. Will I get widow's benefit? Yes, both of those will switch over. So your widow's benefits are already your widow's benefits. So that's not going to switch because you turn full retirement age. But your SSDI will switch to regular retirement benefits. The check will stay the same. So a lot of people don't even realize it. So you're good. It'll be an automatic. But remember, because you're no longer on SSDI, you're no longer under your full retirement age, you can now work as much as you want. If you're able to work and you were always paranoid about working while receiving disability benefits, you don't have to worry about that anymore, because once you turn your full retirement age, you're no longer receiving disability benefits, right? You're receiving regular retirement benefits, and because you're past your full retirement age, doesn't matter anymore. So, and you no longer have to stress out about those CDRs, the continuing disability reviews, because you're not on disability. You're on regular retirement benefits. So, let's see. Do we have to get all documents Apostle, including Social Security card? Apostle? Not sure what that. Sandy, I'm 65 on Social Security. I have investments in the stock market and that I would like to cash out. Are there any limits to doing that? Are there consequences that impact annual Social Security earnings? If you're on just regular Social Security and not SSI, the welfare-based program, then nope, no problem whatsoever. Social Security since 1935 has recommended you do that. So no effect on your Social Security. It could affect your Medicare. If you're receiving Medicare and you get higher income or investments, sale of a house, all of that could affect your MAGI, modified adjust gross to income. And that would put you in a higher bracket for your Part B premium. Most people pay $185, but if you're in the high income group, then you pay more, $100, $200, $300, $400 or something for your Medicare Part B premium and Part D premium as well for 1 year while you continue to make that kind of money. It kicks in 2 years after that. So it could affect your Medicare Part B premium and Part D premium, but it won't affect your Social Security at all. So next question, when I turn 65, do I automatically lose Medicaid coverage? No. If you're on Medicaid, you will need to sign up for Medicare. The states always, typical bureaucracy, one entity wants to push costs over to another government entity. So when you turn 65, if you're eligible for Medicare, you have to sign up for Medicare. But if you're on Medicaid, make sure you contact Medicaid and say, hey, I'm going to sign up for Medicare here at 65. Are you going to pay for my Part B premium? And sometimes under the president, he passed a regulation to make it easier to do that. But in the big, beautiful bill, they decided to make it easy for you is not beautiful. So they delayed that extra help for 10 years. So now it's difficult to get it. But fight for it. Fight for it. So Medicaid, tell them to pay for your Part B premium, and you might be out for the $185 for a month or two because of this, because it's a beautiful thing, according to politicians, to harass you and give you a hard time doing this. So you just have to fight for it. But if they approve it and you do pay the $185 for a month or 2 months or 3 months, they will reimburse you if they approve you during that time. So definitely fight for it. And then when you have Medicare and Medicaid, you're called what's dual eligible. That means you have two. And that's when you can get those Medicare Advantage dual eligible plans that have all the extra benefits. And so see if it's right for you. And always, unfortunately, if you have Medicaid, then you can't get a Medicare supplement plan. So I always recommend checking out Medicare supplement plans. But if you have Medicaid, you can't get a Medicare supplement plan. The only option is a Medicare Advantage plan. So, but you just need to see if you can get one. Well, you will be able to get one and see whichever one's best for you. So, but never focus on the bells and whistles. Always focus on, your physicians. Make sure your physicians are covered. Make sure your prescriptions are covered, and check out the prices. And then you can check out all the extra gym membership and all that stuff. So, Angling King, will AI robots who replace millions of workers pay into Social Security? No. Yeah, that's another thing that's going to be hurting. Right now, 90% of your Social Security check comes from people currently working. The other 10% or so comes from the trust fund. And when less people work, replaced by AI and robots or whatever the case may be, or your jobs are shipped overseas, then yeah, that's less money going in and more money coming out of the trust fund. And therefore the trust fund, the cupboard is bare sooner. So let's see, digital currency. Yeah, I don't mess with digital currency at all. So I have no idea anything about digital currency. So I'm gonna skip that question if you don't mind. Just past my renewal for this year, I was worried. I heard somewhere you lose it at 65 and have to do an Advantage plan. Nope, you don't lose it. But again, definitely check out Medicare, and then if you're dual eligible, then you can see. Yep. Please, Dr. Ed, don't give this administration any ideas. They're already killing us a little bit of time. Yeah. I mean, it's, I forgot to mention a couple of things. I always try to be fair. So when they were going in there and cleaning up those records of those millions of people, there was news that they had unintentionally deceased somebody in, I think it was a guy who was in Seattle. And to be fair, that unfortunately happens quite often. So that's just, I don't think that was DOGE's Elon Musk's fault. It could have been, but those things happen every now and then. What it usually is a funeral home or someone, they submit the death certificate to the state, and the state notifies Social Security, and Social Security notifies Department of Treasury and all that stuff. And usually it's the funeral home or the coroner's office that type in the Social Security number wrong. And the person that actually deceased was, Social Security, the last one was 1-2, and they actually type in 2-1. And then someone on the other side of the country all of a sudden finds out that they're deceased. That happens every now and then. So I'm not going to blame Elon Musk and DOGE for that one. And also, good thing they're updating the computer system. It's been based on COBOL and Fortran from the 1970s. Social Security has been begging Congress for decades. We need to update the system. We need to update the system, and Congress refuses. But now it looks like they just might be updating the system. But as people that watch this channel know, I'm not a tech guy. But a lot of people that are tech guys saying, yeah, they said they're going to update the system in about 6 months. They can't do that. I'm starting a website, another part of my website, to help people with Medicaid and continuing disability reviews and Social Security and all that kind of stuff. And even that's taking, a lot longer than I thought it would. And that's just a, minor. Well, I think it's major for a lot of people, but anyway, hopefully they don't break it. Hopefully they do it right and they fix it. My fingers are crossed. So that is good. That is good. So, how do I get back pay for? Okay, I already answered that one. Tariff money can help. That laugh out loud. Yeah, it's basically, they admitted it's a sales tax. Tariffs is a sales tax. We are paying it. We're paying extra, and that money, and it's not coming back to us. So. Is back pay while waiting for disability taxable income? Yeah, you need to contact the IRS on that one. You're a tax person. It could very well be taxable, but it really depends how much it is. So I never worked for the IRS, so I'll skip that one as well. No digital currency and no tax consultant here. How do I get back? Okay, I already answered that one. Clinton, okay, wait a second. All right, I'll skip that one. I have to believe AI will create more jobs than it takes. There may be a span of turnover. AI is going to create jobs we can't even imagine as required college, what we give up and let China develop it. You never know. You never know. I've tried using a whole bunch of AI for different things, and it's not even close to being there. For simple answers and stuff like that, it's okay. But for doing more complex stuff, it's not even close. Stopping benefits, then pay back after starting seems like taking a loan on your money interest-free. Is this for the first year of collecting only? Yes, it is. Yeah, it is. You're 100% right. That you start your Social Security benefits, and then within 12 months, you can withdraw your application. You have to pay all that money back. And then it's like the application never happened, and it's interest-free. Yep. And all overpayments are interest-free. So when you get overpaid for whatever reason, because you work too much or whatever, and they send you that nasty gram that says, hey, we overpaid you last year by $2,000 because you worked more than you said you were going to work, yada, yada, yada. You need to pay us $2,000. You set up a payment plan and all that stuff, but you owe them $2,000 and there's no interest. And I will take that previous person's recommendation to shut up because, yeah, Elon Musk or DOGE might say, oh, there's an opportunity to make some money. Well, let's start charging interest. So I didn't shut up, did I? Okay. Anyway, a question. If I get my Social Security at 62 and in 89 months, another cut of 23%, do I stand to lose close to 50% of my retirement? Well, I don't know how you're doing that math there, but we want to make sure that doesn't happen. But a lot of people are making retirement decisions on when they're going to start their, Social Security based on, do you need the money? Are you currently working? Are your health and your genes and all these kind of things? But a lot of people also add in the factor of, okay, maybe I should start my benefits now because in 90 months, I don't think politicians are going to fix it. So therefore, maybe I should just go ahead and get while the getting's good. So yeah, a lot of people are using that as a reason to start. I moved from Kansas to Kansas from Kentucky. The Medicaid lady told me I have to call my Kentucky Social Security office and Kansas Social Security office. I thought it was all one entity. Please advise me. Yeah, wherever you move to, you moved to Kansas. So you contact Kansas. Yeah, Kentucky is gone. Well, you have to contact them and tell them you're no longer living in the state. Because if let's say something happens today in Kansas, you have to go to the hospital or something and you show them your Kentucky stuff. Kentucky is going to say, hey, no, we're not going to cover it because you're no longer living here. So you have to make sure you get that switched over immediately because states don't like paying. If you're over there temporarily visiting and stuff like that, then that's a whole different issue. But if you made a permanent move, you really need to switch over. And the worst part is this administration does not care, no matter what we say. I guess we just wait until 2032 and take it with like a loss. Pray you don't have any major problems, health. Yeah, this the healthcare system has been on the precipice of disaster for a while, and now kicking millions of people off of Medicaid and the Affordable Care Act marketplace. And people are gonna say it's only those lazy people that are immigrant. No. If you're in this country illegally, you cannot get Medicaid. Period. End of story. If you were, in a massive car accident or something like that, you go to hospital, the hospital has to treat you. And in those cases, they don't check IDs and, your immigration papers and stuff before they, put you back together, restart your heart. And in those emergency situations, rather than the hospital taking the hit, the hospital lobbyists have convinced the government to, pay for it. But that's very, very minor part. But in terms of actual Medicaid, being on Medicaid, you have to be in this country legally. Some states, provide, health care to, people in their particular states, but nationally, you have to be in this country legally to get Medicaid. And so the whole thing about they're kicking off people that are not entitled, those lazy 26-year-old gamers, living in their parents', basement, that only accounts for maybe 1 or 2% that are not working, 1 or 2%, but they cut over 10% of the budget. So the math ain't mathing. So there's going to be a lot more people cut off, and yeah. And usually how they do it is they don't necessarily pass rules and regulations to cut people off. They just make it super, super difficult. And then you get bureaucratically disenrolled, even though you're eligible. And this has happened before. The last time during the great unwinding after the end of the pandemic, about 69% of people were kicked off that were actually eligible because of all the bureaucratic BS. In Utah, it's like over 90%. I saw statistics in Utah that's such a bureaucratic nightmare in Utah that like 90% of people are kicked off that even though they're eligible. And so that's how they're going to do it. But we are coming up with a plan to make sure that doesn't happen. And we're fighting back. So stay tuned, subscribe, save, whatever. I started at 58 on SSDI and lost 30% of my retirement. Too sick to work. Now I will lose 23% more. It's just wrong. I started working at age 12, low wages most of my life. You didn't really lose 30% of your retirement. When you're on SSDI, you basically get your full benefit amount. But I kind of see what you mean. What you mean is you started your benefits at 58. And then when you looked, at your My Social Security account, and it said, let's say at your full retirement age, you'll receive $2,000. So, and then you file for SSDI at 58 and you're approved at 58, and you're not going to receive that $2,000. You probably lost 30%. So what? $1,400. Okay. And you're saying I lost 30%. No, that's the reason is because the estimate on My Social Security is an estimate going forward. So at 58 years old, if you looked at your My Social Security, it said, hey, when you reach 67, here's how much you're going to make. But that's based on an estimate that you're going to continue working at 59, 60, 61, 62, 63, all the way up to 67. Basically, how much you're earning at that time, they project forward, and that's how they came up with the $2,000. Because you don't have that, 9 years of work there, that's why it was reduced. So you lost, but you didn't really lose because that was just a projection, an estimate of a projection in the future. But I know it's still not, yes, you're still not getting that money. So however they cut it up, you're still not getting that money. And if politicians don't do anything in the future, then yes, it's unfortunate. So we're going to make sure that doesn't happen, right, Bonnie? We're going to do everything we humanly can do possible to make sure politicians finally listen and finally focus on, and rather than trying to, attack Social Security and make us hate Social Security. So outdoors life survive craft. All right. I am 60 years old, still working, but my body is broken and I doubt if I can work much longer. Yeah, with an outdoors life survive craft, yeah, you've definitely pushed yourself. That's what we used to say in the Marine Corps, as we used to run so much. And it's like, yeah, when we get 60 or 70 years old, our heart's going to be pumping away while we're in our wheelchair from our knees, being torn up because of running so much. Yeah, with all that heavy gear, the Alice pack and the M16 and all that stuff. So anyway, yeah. Do you have any advice for me? Okay, so you can, if you're not able to work because of a disability, that disability is going to last 12 months or longer, then I would file for disability. If you're, you have to stay under the monthly substantial gainful activity. So the first month you go under $1,620, you can go ahead and file for disability and get your disability started. Okay. Or you can wait till 62 years old and just go ahead and start collecting your Social Security benefits at that time. And then there's a higher threshold for able to work. So if you're able to work part-time, cut back your hours or something like that. So at 60, that's your options. File for disability benefits, and then just stay on disability. You'll stay on disability as long as you're disabled until you hit your full retirement age, and then it's switched over to regular retirement benefits. So those are your options. So, and that doesn't, maybe you file for disability benefits or you file for retirement benefits, whatever the case may be, and then you give your body a year or two break, take care of yourself, stop the outdoor life, survive craft. If you probably do that, it's probably in your DNA, so you can't. And then you recuperate. Then you can just, call up Social Security, if you're before your full retirement age, 65 years old, and say, okay, I'm feeling a lot better, so I'm going to go back to work full time, stop my checks. and they'll suspend your benefits. You just tell them that you're going to be make way over the annual earnings limit, and they'll suspend those benefits for that time. If you're on disability, then just tell them, yeah, I've recovered, I'm able to go back to work, and you just keep on keeping on. Yep. Let's see here. Dr. Ed, if I'm on SSDI, I make $3,500. Can Medicaid help me with food cards so expensive now? Yeah, if you're getting $3,500 from SSDI, wow, number one, you've put a couple hours of work in your life. That's a very high benefit amount for SSDI. For any amount, that's high. So, but yeah, for Medicaid, well, I correct myself because all states are different. I had someone that would on SSDI particularly. I had someone that was making X amount for SSDI in one state, and they were approved for Medicaid, and everything was good. And then they moved to another state, and they denied them. Some states they count Social Security disability insurance, and other states they don't. So I think it might be a tough call with 3,500, but hey, it doesn't hurt to try it. Check out your state and see if. Yeah, but in terms of the food cards, they used to have a lot more last year. This year, it's those food cards. Those are tied to Medicare Advantage plans. You can call chapter and they can see if there's one available at Medicare Advantage that has a food card. But most of those food cards are connected to those Medicare Advantage dual eligible plans. At least the best ones, the ones with the most money, are connected to the dual eligible plans, the DSNPs, dual special needs plans. But you can reach out to, whoever, reach out to chapter and say, hey, is there one in my area that can help you out? So Vince, what are the chances of the Medicare Portability Act passing that allows Medicare to be used outside the United States? Rough estimate, zil and none. Yeah, I think that was started by some guy that's expat in the Philippines, and he went to Washington and tried to do stuff. But yeah, it's Medicare. Medicare is already going to be hurting. They're already going to be losing about $535 billion. And to expand services to people overseas, I don't see it happening. Could be wrong, but I don't see it happening. And people said, no, they're not cutting Medicare. Yes, they are. Because of a little thing called pay-go. It was a law passed in 2010, 2011 that says, hey, if you pass a bill that creates a deficit, which this one creates a humongous deficit because we need to give more money to rich people, and they try to cut as much as they can from the poor people, but they didn't cut enough. Anyway, so if a law passes that makes a deficit, then Congress or the Office of Management of Budget, a guy named Russell Voigt, Project 2025 guy all day long, he is ordered to cut. And he can't cut Social Security, that's in the law. He can't cut Veterans Affairs, that's in the law. The next one down is Medicare. So we're looking at about $535 billion cut in Medicare. So we're going to see a bunch of changes trickle down for Medicare, reduced networks, reduced payments. Some doctors and hospitals are not going to want to take Medicare. That's going to affect Medicare Advantage plans, prescription drug plans. And this is all going to happen sooner than you think. And next year for 2026 is going to be not so much fun. Yeah, across the board. And Medicare system, the healthcare system in America was already hurting. And this is kind of pushing it over the cliff. Little girl with pretty eyes. If you are getting full Social Security and still working money I am paying into Medicare and Social Security, will it be added to my payment I'm receiving now? Yes. So if you are receiving your Social Security benefits and you're currently continuing to work, and that work is one of your high 35 years of earnings, absolutely, it will add to your Social Security check. Yep, and that's automatic. You don't have to do anything. That's 100% automatic. So what happens is when you file your taxes or, beginning of the year, your employer or the IRS notifies Social Security and they say, hey, little girl with pretty eyes made this much money last year. And then Social Security looks at it and says, hey, this is one of her high 35 years. So let's kick out a low one, stick in a new one, recalculate, and increase your benefits. That's 100% automatic. It doesn't come January 1st, you know, because need time to get the notification. But if it does increase your benefits for that year, they give you the retroactive back to January, but sometimes it takes many, many months. So, all right, I've got some video questions. Let's see what we got here.
Yeah, my name is Ruby. My spouse was born in 1952. He passed away in 2008. I applied for survivor benefits in July and August of 2023 at my full retirement age. I received his benefits and recently applied to switch over to my own benefits a month ago. So I basically want to know, did I do the right thing, and how much should I receive, including those credits?
Wow, she has a PhD in Social Security. So good on, yeah, it sounds like you did everything 100% right. You filed for your survivor benefits. You did not touch your own, and you collected survivor benefits. And then at that particular time, your benefits on your own record were more, or you hit 70, that's when it's going to stop increasing. So you start your benefits at 70 years old, and you got those full delayed retirement credits. So yeah, if you filed last month, sometimes the delayed retirement credit. So if you're going to get the full 24% of increase above and beyond your, you know, your full benefit amount, 24% extra because you waited till 70. Sometimes it depends on a few factors, but sometimes they will give you like the 2 years. They'll give you the 16%, so 8% per year, 8%, 8%. But the other part, because it's partial months, sometimes it takes a little bit of time to do that in the computer system. So sometimes you'll receive the entire 24% extra in one check, and that'll continue on forever. And sometimes you won't. You'll receive only, you know, 16 or 17 or 18 or 20%, and the other one will be calculated at the end of the year, and you'll be made whole. You'll get it all. It just sometimes the last few percent, the last few months, it takes a little bit of time. So don't worry about that, but keep an eye on it, and make sure you actually do get it. So, all right, let's see. You got a few more, just four today, 4 video questions.
Mr. Ed, this is Andre Williams coming in. I have a question regarding Social Security for my senior mom. Mom is 82. And she is a surviving spouse. And the question is, I think you said in one of your shows that mom could get Social Security from her late husband if it was higher. So she has a choice to get one of the two. Please, can you tell me a little bit about that, if I'm correct, if I heard it right? If not, I appreciate you clarifying everything, and I appreciate all that you do. Thank you.
All right. Number one, awesome for looking out for your parents. You're too awesome. They took care of you for a few years, I'm sure. So turnaround is fair game, right? Perfect. Awesome. Yes, just as the previous, the one that has a PhD in Social Security, exactly that. So once you're eligible for both, that's exactly what you do. So if you're eligible for retirement benefits on your own record and also survivor benefits, you play around with the numbers. You look at the numbers. What a lot of people do in that situation, they go ahead and get survivor benefits and then don't touch their own and let theirs continue to increase until they turn 70 years old or whenever the benefit is higher and they want to get that extra money. And so, or some people start benefits on their own record first if they're below their full retirement age and wait for the survivor benefits to increase, because if you take survivor benefits early before your full retirement age, that's also reduced in a lot of cases. There are some exceptions there. But you go into Social Security and you just say, okay, if I start benefits on my own, how much am I going to receive? If I start survivor benefits, how much am I going to receive? And then say, on survivor benefits, I wait till next year. Will they increase if I wait till next year? And that'll tell you whether they increase or not, and whether you're part of one of those exceptions. And then if you don't want to do either of those, then you just tell the Social Security person, okay, I will hold off on both of those and I will call you all next year. So they're not going to push you to do one or the other. They better not. If they do that, if they can make recommendations, but they say, no, you've got to file. No. There are certain circumstances you do. If you're on SSI, supplemental security income, you got to file for any other benefits you're eligible for because you're on a welfare-based program. So, all right, let's see. You've got two more. Let's see what we got here.
Hello, Dr. Ed. This is Rick from East Tennessee. And I have a question for you about what's considered passive income and earned income as far as Social Security and Social Security disability is concerned. My brother wants to start a YouTube channel and earn revenue from ad views. And from what I see, it's considered earned income because they give you a 1099 at the end of the year. But he claims that his disability lawyer says that that you might have to report it, but it's not counted against you as far as your income limit. So I don't know. Just for reference, he is below the age of 67 and he is on SSDI.
Okay, perfect. Thank you for adding that part. So he's below his full retirement age, so work is an issue, and he's on SSDI. So, yeah, all this YouTube type stuff and social media, making money off of it. Number one, good luck, because it's difficult, but it is work. It is new to Social Security. I'm sure they're trying to figure out all of the parameters for that. But if he's actively making videos and he's getting that 1099, then they could very well say, hey, you're working. I just saw you on YouTube. And it's easier for them to check too. You go in there, oh yeah, I'm not working. And then they pull up your YouTube channel and you're just like, well, you just made a video today, right? So they could very well consider that work, earned income, and then count that against you. Remember, for the first 9 months, so he can make as much money as he wants because he's in a trial work period. So I would pump out tons of videos for the first 9 months. And if you make $1 million, it doesn't matter because you're in your trial work period. And then, I don't want to connect those two, but on a separate note, if you made a whole bunch of videos and you just stopped doing it, then that's kind of like royalties. It's no longer earned income anymore. It's like we used to have a lot of actors coming into our office and they would make royalties from, being in the movie Casino or something like that, or as a kid, whatever, the judge in Casino. So, but yeah, that would be royalties. That's not earned income. That's unearned income because it's, a previous time of working. So is it earned income? Yes. Can it also be unearned income? Yes. So, but for the first 9 months, it doesn't matter. Tell him to knock himself out. And hopefully he makes a lot of money and contributes something good. Hey, cat videos are awesome, but we need people on the social media with actual experience helping people out. So, all right, last one, and then we'll call it a day. Because it sounds like you're under your.
Hi, my name's Denise. I'm from Tucson, Arizona. I've got a question. I'm receiving surviving benefits. I'm also on disability, but it doesn't seem like I'm receiving the right amount. I only received $300 amount, and I think that he worked a lot more than that. So you're saying I should get at least 50%. I don't understand, but they gave me surviving benefits for $300 a month, and my disability I get. So you also mentioned a disabled wife filing for benefits. I'm really confused about all of this. If you could clarify any of it, I'd greatly appreciate it.
Okay, so yeah, you're getting 300 or so from him, but it's basically, if you're entitled to, let's say, $1,000 from him, and you're already receiving $600 from SSDI or retirement or whatever the case may be, then that offsets that. So you're not going to receive 2 full checks. You'll receive your full check and the difference between yours and his. So it sounds like, you're receiving $700 on SSDI, you're entitled to $1,000 from him. You're not going to receive $1,000 plus your 700, your SSDI, for a total of 1,700. You'll receive $700 on your own record, and then the difference between that and how much you're eligible for from his. So his is $1,000, you'll receive the $300, the difference. So that's how that works. So, I mean, and beyond that, if you disagree with that, you can always file reconsideration, SSA 561. If you still disagree, then you can say, hey, I'd like someone to double check my numbers and make sure they're correct. So you can definitely do that anytime you want. So, all right, we are over an hour, and I appreciate y'all. I'll be back again tomorrow. I think we're gonna, I forget what we're talking about tomorrow, but we'll talk about something tomorrow and answer a whole bunch of other questions. Y'all have an awesome night, and please